you. Hello, welcome to our first edition of our STEM Unplugged series. Today we have Chris Espersen, who is a quality consultant working with healthcare and public health organizations across the nation, providing technical assistance around new initiatives, data fidelity, patient engagement, and quality improvement. Prior to her consultant work, Espersen was the quality director at SQHC in the Midwest. Chris has provided training and TA both domestically and to groups in Asia, Africa, and Latin America. She is an adjunct instructor at Drake University, where she teaches social determinants of health. Espersen speaks nationally on a variety of topics, including value-based payment, social determinants of health, patient and family engagement, and topics related to data-driven quality improvement. She is co-chair of the legislatively created Patient-Centered Health Advisory Council and is asked to participate on many healthcare transformation and equity committees. She is primarily interested in reducing healthcare disparities among underserved populations and in fostering patient empowerment. Please welcome me in joining Chris Espersen.
Thank you so much, Brooklyn. I'm so excited to be with you all today. So this session is going to provide an overview of how data can tell the story, showing agencies and organizations how they're closing the gap to address social determinants of health. And so really, we have a couple of tools to make this engaging and also to make sure that you get the most out of this. So what we want you to do is head out your to-do list or your idea journal, whatever it is that you write things down, or even better, hit pause on this recording and go to the YouTube, open up within the description box the worksheet that accompanies this. You can also open up Simplify, because we're going to post that worksheet there, as well as a couple of other resources we're going to be highlighting today. So make sure that you do this. For those of you who are not signed up for Simplify, you're going to also find in that description box a link to sign up, so you can just access all of that great stuff within this video. So these are the things we're going to cover today. And it's all about how to harness the power of data by effective use with those data and telling your story. And so back in April, we connected on Zoom, and we talked about the 5 elements to your data story. We're going to go in depth into some of those elements today. So we talked about how to work with the data at hand. And that's really this first bullet point of using your social determinant of health data to help target those underlying factors that may influence health. So for example, areas without adequate food or transportation. Some of our counties don't have adequate housing. We're also going to explore the possibilities, and this is where we can really connect those data to advocate for and get support and resources for those identified areas and populations. And then the last 3 elements we spoke about in your data story back in April is setting your bold aim, visualizing your data, and making those data come alive. And this is, we're going to cover a lot of this in demonstrating your value to the community using your social determinant of health data. So without further ado, let's jump into that first point. And the first component of our data story, let's talk about social determinant of health data to help target those underlying factors that are influencing the health and quality of life of our neighbors here. We're going to talk about assessing publicly available data. We're going to talk about some of the sources of public data sets. We'll talk about understanding differences within populations, sharing data, and having conversations around data. So the publicly available data we have at our fingertips, literally online, at our libraries, wherever, it's really good to use as a starting point. But it's also good to compare to your own data. What information are you collecting that's similar to those other data sets that are publicly available? This is a great opportunity to amplify what's going on at the community level, to collectively advocate for resources. It's also an opportunity to provide a more accurate picture of what's happening. We used to do this with our mandatory annual data at our clinic. It was always interesting to see where our patients ranked with the other populations that we're seeing on maps such as this here. We were able to point out nuances in the different population subsets, and then identify potential areas for most focused and culturally appropriate resource allocation. So in doing so, it's important to closely examine our populations and measure definitions. And so we collected data at our organization. We had certain parameters we had to use, and those parameters don't always line up with sources like displayed here with the county health rankings. And so we just really need to make sure that we're comparing those apples to apples. So at times, these county-level data, especially those related to healthcare, can be limited to certain age groups or insurance status, such as Medicare. And this may be a very, very different population subset than you serve. So this is why that adding to this data conversation is so important. Your data and data from your partners can help piece together that larger information jigsaw puzzle and add context and content to collaborative, data-driven efforts. So if data visualizations accompany the raw numbers, make sure to understand what they are demonstrating. So for example here, the lighter colored counties, according to these data, are better off than some of these darker colored counties within child and poverty. So just really understanding that and making sure that your own data visualizations mirror those definitions so you can really make a more effective comparison. So, what are some sources of social determinant of health data? There's just a few here. If you want more ideas where to look for on the Simplify platform, you're going to find that reference guide from last year. And so this was a very large document. It was really meant to have a comprehensive set of social determinant of health resources. And within that, there was a large section on data sources specifically. It also talked about what geographic level they're collected at, what type of measures they're looking at. So if you're having a hard time finding that on Simplify, don't feel afraid to reach out, send an email, post on Simplify, whatever works for you. And we're very, very happy to give that to you directly. So on this slide, you can see a couple of different data sources. The BRFIS, or the Behavioral Risk Factor Surveillance System, is a system of health-related telephone surveys, and these collect state data about U.S. residents regarding their health-related risk behaviors, their chronic health conditions, and their use of preventive services. So in Iowa, in particular, in 2012, questions were added to this BRFIS data to understand and document ACEs, or adverse childhood experiences, in the Iowa population. So something extra we have in Iowa, which is pretty cool. The Community Commons is created by the Institute for People, Place, and Possibility, collaboratively with the University of Missouri. And it has not only data, but tools and stories with the intent to improve communities and inspire change. Within this tool set, there are three main components. So the community health needs assessment, and this really helps identify assets and potential disparities in your region related to community health and well-being. The vulnerable populations footprint, and this really allows you to identify areas in your community with low educational attainment and high poverty. So definitely some very important social determinants of health. And then the location opportunity footprint. And this enables users to find areas of opportunity in your community, map housing and transportation costs, school proficiency, and availability of jobs. So it's really a robust tool for you to be able to use and play with. The census data, something we're all very familiar with. This also has data on poverty, housing, and food quality, just to name a few. And then the Environmental Protection Agency. It used to collect data on air and water quality, something else that's very important in the lives of our neighbors here in Iowa. So these are just a few examples. Again, visit that Social Determinant of Health resource guide on Simplify for more ideas. Or also, if you have other favorite data sets, please add that to the conversation on Simplify as well. So let's talk about understanding differences within the population. So in the 2008 Commission on Social Determinants of Health final report, the World Health Organization stated that for a health equity surveillance system, health outcomes should be stratified at a minimum by the factors laid out on this slide. So this is very similar to how we stratify data in our clinics. Many of our measures, our health measures, our diabetes measures, our obesity measures, what have you, we would stratify those by sex, zip code, ethnicity, insurance status, housing status. And so we didn't obviously stratify patient populations on regional markers, again, being that most of our clinics were in the central region of Iowa. We would stratify based on clinic itself, which were geographical by definition. Maybe they were in a different city or part of the city, but it allowed us to look at differences in that way. So it's really useful to compare your data to other organizations in the county, as well as the county level data itself. And so those are data for all the different people within the county, again, depending on the definition. So stratifying these data really enables you to tease out the similarities and differences and expose the omissions caused by differing universal population definitions. And just thinking back to that map on the county health rankings, Dallas County in particular, it looks like child poverty isn't an issue. But again, that's glossed over because of the way the data are collected and displayed. There are very significant pockets of child poverty in Dallas County. So, for some of the ways that we did this is that we noticed that our patients differed considerably on A1C and BMI measures when we looked at our entire county level data. And so we found further that these measures were based on the Medicare Expenditure Panel data, or MEPS. And we found that definition, and we stratified by the same parameters. And so this showed our Medicare patients approaching similar outcomes to the county level, even though disparities still existed. We stood by that our Medicare patients were more sick than other Medicare patients in our state. But there's other categories demonstrated there might be other non-Medicare opportunities to improve these indicators. So I would love to know from you, what potential data would you like to examine in a similar way? Again, use the worksheet. On the worksheet, it asks you to say, this is something that I want to do based on what we're talking about today, or this is something that you're doing a really, really great job, and you have the opportunity to share with other C3s. So please mark that and let us know what we can all do together. So, let's talk about sharing data. This can be fun, seriously. I've seen many times in different communities, organizations holding tightly to those data and just allowing the slightest peek at some insignificant 50,000-foot aggregation that tell really little about a problem that the community could perhaps solve collaboratively. These conversations are dull and they yield little. More and more, we've been coming into an age of greater transparency as payers and funders have collected data on different organizations and their outcomes. And then they have the audacity to post them online for all of us to see, so we can really see how each other are doing. Let's kick this up a notch. I hope we can really be more proactive in our communities of sharing before it becomes mandatory public knowledge. But if it doesn't, let's just be bold. Let's come together and bring offers to the table of what excellent data sharing looks like and what it means to our community. Sometimes we need to make the first step in sharing data. Sometimes there's a great payoff in being trailblazers in this area, be it in the form of grants or becoming a partner of choice to leverage resources, or just really being that go-to person. But at other times, it makes it less scary for others by being the first to share, and that can really cause others to follow suit. So whatever the case, just have a quality improvement plan back at your organization, because some of those measures are going to be less than stellar, and we're going to want to make sure to clean them up as we share them. So it's also important to be having a discussion. So now that you've figured out who collects data that impacts your patients or clients, or who's interested in your data, it's really great to have discussions and explore the possibilities that exist. So if you're solving a problem that affects a group of people, it's important to involve community members who are impacted by that problem. This is because in order to solve a problem, we need to intimately understand why the problem is occurring, and community members have the insight into the why. And to show a really micro case of this, Laura Adams at the Iowa Healthcare Collaborative meeting this week at the annual conference, She talked about that patient with an incurable cancer, and she talked to the doctors. She knew she had enough health literacy to understand that her condition, she was not going to get cured. But those doctors said they were going to throw everything at her cancer. They were going to make sure that she got all of the care that she needed, and they were going to attack those tumors the best way they knew how. But they weren't taking into consideration her goals. She knew that if she had all of that treatment, her quality of life was really going to suffer. She really wanted to live the best life in her limited days. And she fortunately had the ability and the access to make her goals known to those doctors. But our community members don't always have that information. They don't know that we're having these conversations. They don't know that these grants are available at times. And so it's really important to make them aware, and we can understand their goals and solutions to these problems. And so they can be a part of that. So we're going to talk more about ways to get that in community input shortly, but let's talk a little bit about how the same thing, the same concept is important for conversations with our community members. They often have complementary information on those same populations of interest and the relationships with key community thought leaders. So we really need to share and make sure the data among agencies can complement each other and provide that richer understanding of a problem. So again, hopefully you're using your worksheet, you're jotting down notes on what data you want to look into, how you want to further analyze internal and external data, how you want to share those data, and the conversations you're going to have. And so if you have further questions on these items, just hit pause and open up an email or post in the forum on Simplified. You have lots of tools. Make sure that you're able to use them. And luckily you can do that because you can hit pause. So let's talk now. We've talked about using data to discover those underlying issues in the community. We're going to talk now about connecting the social determinant of health data to support resources for identified areas and populations. So in this section, we're going to talk about mapping out your community, identifying opportunities, analyzing those gaps, and setting goals. So a couple ways you can do that. Windshield and walking surveys. They're a great way to start mapping out your community. So when you're, the windshield is really talking about driving in your car around a community, and walking, obviously you're just walking in that community. But this way you can really examine those physical attributes of the community, such as housing, the businesses that are in that community, recreational and cultural opportunities, availability and condition of infrastructure. You can also observe social things such as interactions, the makeup of populations and the organizations, and the institutions that really promote learning and social interactions. And you can just get that general feel of the community. So if you have an idea of the needs of your population, you can also research resources online. So you don't even have to go out in that cold weather we're having today, but you can use those resources to identify areas where the resources are concentrated, and if there are areas of resources that are lacking. And then finally, geographical information systems mapping is a great tool. Maps are so much fun. People always like to look at where they rank. And so last year, we at the Iowa Primary Care Association provided some resources on this. And so be sure to check out Simplify again to access them and let us know what questions you have. And again, if you're having trouble locating those, we're very, very happy to point those out to you. So we really want to fully understand an issue before seeking solutions. We really need to have a good idea and ask those questions to make sure that the solution we're proposing is appropriate. So we need to understand if the problem occurs too frequently, if it has lasted for a while, so what's the duration of that problem? Does it affect many people or just a certain group? Is it disruptive to personal life or the community life? And how severe is that problem? Is it an equity issue where it's depriving people of legal or moral rights? Is the problem perceived as a problem? I know that sounds funny, but this is a really, really important one because sometimes we see the data and we see this problem, but people do not perceive that as a problem. Maybe they've become immune to it. Maybe they're just used to it. But this really helps indicate whether people are ready to address that issue within the community. So that perception is key. So there's also a brand corporation paper. It's called Collecting the Dots, Problem Formulation and Solution Elements. And this is written by Martin Lebecki and Sherry Flieger. And it talks about collecting dots. This was also a theme discussed by Laura Adams at the Iowa Healthcare Collaborative Annual Conference. So this publication is freely available, and we're really happy to share if you want immediate access. But it talks about these barriers and lack of awareness, attention, and understanding, as well as information hoarding that occurs. And it talks about the solutions to combat these. So some questions we can ask related to collecting and connecting the dots are, what resources are abundant and which need more emphasis, conversely? What are the connections that are strong? What are those that really need to be strengthened? So we need to connect those dots a little bit better. What are those ways that communicating different things that are happening that really work well and we can amplify these, opposed to those that really didn't go over so well and didn't get our message out there? And then what are the opportunities that can be matched with these needs that we identify? So all of this information about this current situation and the ideal future situation are a really great start to your gap analysis. In addition, you'll want to ask, what is the issue that needs to be solved through a change in order to fill a gap? How do we get from here to there? What are the steps of change to bridge that gap? And what are the requests to your decision maker? So there are a lot of tools out there that can help. It's good to keep in mind that it's really great to use mixed methods. So as you're doing a gap analysis, there's lots of documents you can review, but it's really great to get input from stakeholders on those gaps as well. So it's really important to set a goal and know where we're going. We have to know if we're headed in the right direction. We have to know when we get there. And it's really important to set both big, bold, and audacious goals, and then accompany those by smaller goals along the way. So SMART goals, they lack in popularity in certain areas. One of the criticisms is that they are tend to be smaller, the way that these different SMART, specific, measurable, achievable, relevant, and time-bound criteria are laid out. But when you accompany that by that big, bold goal, you kind of get away from that concern. The other thing is that when you have these sorts of SMART goals, you're able to celebrate, whether that's within your organization, whether it's in the community. But it's really, really important to be able to have that and highlight the great work that people have been doing. And goals help to do that because they help to know when you get there and it's time to celebrate. It's really good, to involve the stakeholders again. I just want to hammer home on that point, in finding the solutions and the action items to meet these goals. So we as leaders can set the goals, but let's have the people set the action items. We cannot fix everything from our 50,000 point view. We really need people on the ground to be doing that, and they have the great ideas in order to help us meet our goals. So, some people are going to tell you to only start small, and you're going to make those small cycle changes and test as you go along. And for many organizations and problems, that's the way to go, is to start small. Some problems require re-engineering, however, and you really have to go big or go home. And just one example of this in the book Being Mortal by Atul Gawande, he tells us the story of this young doctor in upstate New York that needs a life change. So he leaves behind his job in the emergency room, and he becomes a medical director at a nursing home. And so he's just immediately, when he walks from the door, he's overcome by the depressing aura and the complacent staff. And so he immediately tries to start fixing all these problems. He did what his medical training taught him to do. And he did as many tests on the patients and exams. He did as many as possible, and there was no change in the health of the residents as a reward for all of his hard work. So he decides to conduct a grand experiment to inject life into the nursing home. And he convinced administrators to bring in dogs and cats and birds, which is great. But the only problem is he didn't have a plan for feeding and cleaning up after all the four-legged creatures, and the birds arrived en masse before the cages arrived. And when the cages arrived, they arrived unassembled. They did arrive the same day, luckily, but they still were not put together. And it was quite a chaotic scene. But the staff pulled together, and the big changes happened in the health of his residents and in his staff over the next year. So their point really is to start with energy and passion, then test and grow in the way that makes most sense for your community. Okay, so we've talked about using data to discover the underlying issues in the community. We've talked about connecting those social determinants of health data to support resources. And now we're going to wrap up with using data to demonstrate value. So we're going to talk in this section about measurement, about audiences, community input, documenting return on investment, and telling your story, just to name a few. So again, important to measure your goals. It's important to look at data frequently. You're going to start with your endpoint. What is it that you're trying to achieve? Making sure that we're collecting the right data to begin with. And so really integrating that data collection into the workflow that goes into your endpoint. You want to assess the baseline. You really want to understand what the opportunities demonstrated in that baseline are showing you, as well as some of the barriers that you have to overcome in order to make some improvements. You also want to, once in a while, look at the fidelity of the data that you're collecting. A lot of times people that are collecting those data as part of their interventions are looking at it in a different way, and they're not putting the data in all of the standardized way. So it's really important to make sure our data are clean and that we can really rely on them to tell us what we think that they're telling us. And again, there's some tools out there for that as well. Helping with both the fidelity and assessing, what our endpoint is, what our baselines are telling us, are incorporating these qualitative methods. And so asking people some thought-provoking questions into some of that numerical data that we're asking is really helpful to that interpretation. And then, some people shy away from data, but this is so important. We have limited resources. We're putting a lot of work into our grants, into our different projects we have. And so we really need to make sure we have consistent data available so we can do continuous quality improvement. And we can solve some things before it gets to the end of our grant year, before it gets to the end of our calendar year where we have to report to different agencies on what we're doing. But we can really, in real time, make the changes to make sure that our goals are matching our interventions that we're doing today. So really, really important with the data. We also want to identify audiences. We have a huge impact we can make on our clients, and we really want to make sure that we are communicating with people who can benefit. Our providers, our medical providers in the community, they have their quality payment programs. Payers are incentivized by decreased total cost of care. The local community economy can benefit from these different things that we're doing. So, what are you doing, and what can you do to make sure that you are communicating with these different audiences the big impact that you're making? So it's really important to, when you're thinking about value, make sure you're defining it from the point of view of the people that you're serving or the stakeholders that are going to be incentivized by different things that you're doing. You really have to make sure that you're measuring the things that you need to in order to achieve that incentive. Aligning those incentives with the stakeholders, making sure that your outcome measures are aligning with these. And so it's really important to keep in mind your audiences so you can create all of this value within your story. So we talked earlier about input, and again, these stakeholders are some great places to seek input. One of the things I like to talk about is being mindful. And so this is the picture of my daughter. And every time she has to, we go to the grocery store, she has to stop by the floral section and smell the flowers every single time we go. And it's just a really good reminder to me. I always have this picture of her in my head of, every opportunity is a way to be mindful. It's a way to get more out of a situation. And so really want to make sure that every interaction that we have is really a gift, and it's an opportunity to make connections with the people you're trying to serve. And so there's so many different ways you can integrate community input. Public forums are a great way to start to understand the problem, just listening and letting people come forward and telling us. You can also do some initial research, like we discussed, with assessing publicly available data. So, trying to figure out on paper what's going on and having that public voice really supplement it. And that community conversation really provides that context and insight into the data. So then there's, focus groups you can do and surveys, even interviews at community events or informal conversations can be helpful. And so, one of the things that we learned at our clinic, I would go into the waiting room and I would do interviews with patients, and I'd be very vague. Hey, how's everything going? Are you enjoying your care? Anything we can do better? And these very vague, broad questions yielded no input. People just said, oh, it's great. We just appreciate you being here. Everything is fine. But when we started to get into more specific things about their care and asking very, very detailed questions, that's when people were really empowered to let us know that, hey, I have no idea what you're talking about. No one has ever given me education on my new medication, or other different things that we were really trying to do. It was really great insight that message was not being received by our patients. So just being really ready to have probing questions and listening to responses you can ask those more detailed questions is very, very helpful. Complaints, one of the things that Dr. Sarah Pavelka said one time, and I had never, ever forgotten, is that complaints are a gift. They're this beautiful gift to be open. And I just thank her for that visual image, because it's so true. When we take off that defensive armor and we really look into that, it's an opportunity to provide better care and better solutions to problems that people are talking about. So a lot of these techniques can be more involved than we have time to talk about today. But if you need more information or guidance on how to do these, please leave us a note on Simplify or reach out via email, and we're very, very happy to post that for the group as well to give you more information. So calculating return on investment is a little bit more involved. It's optional, but it can be a really powerful addition to your story. So we discussed the importance of measuring outcomes to convey your value, as well as to make sure that you're on the right track. Return on investment is another way to make the business case for the work you're doing. So we don't have time to fully cover the topic here. We're just going to discuss some basic points. So you first need to be aware of your inputs in that you understand what kind of resources you need, how much of these resources, for example, if you are going to have a community health worker or a care coordinator, what is the caseload that they can cover, and what are the costs of those resources are. And that can include the opportunity cost in some instances. So your costs are going to include things like the staff salary and their fringe rate, the travel costs, equipment, and any other kind of client support costs that are involved in your intervention. So your outcomes are really important to measure as well if you want to make sure your investment is resulting in those desirable changes. And so sometimes these outcomes are really already associated with an incentive or payment. For example, if someone's trying to improve their A1Cs, they get paid for it, great, there's an incentive right there. But often instead they're a proxy measure that really links to other cost savings or benefits. For example, reduced total cost of care or readmissions that are often correlated with that decrease in A1C. If you happen to have cost data for a specified patient population, sometimes you're able to access that, and that is absolutely amazing. You're really lucky. Make sure you use it. But there's also, when you have, you want to do a less complex way of calculating ROI, there's a simplified document, and we will, again, this is available on YouTube or on Simplify. We'll share that PDF. So some funders or partnerships are going to require a more rigorous return on investment calculation than that which we share. and they might ask you to link a reduction in emergency department visits or total cost of care due to the transportation or advocacy or whatever supportive services you provide. This is a great time to involve graduate student interns or even university research partnerships. They are really excited to partner with people like you, and they can help conduct and provide that skill set to do a more robust evaluation. We have on the YouTube in the description box a link to the CDC website that has curated data on emergency department visits. There's also free healthcare cost and utilization project, or what they call HCUP, tools and software that are available to identify preventable hospitalizations, estimate the cost, assess quality of care and patient safety, a bunch of different things, identify comorbidities, and we're providing you that link as well in case you're interested in that. So, in telling your story, you have the ROI, possibly you have the input, you have the different outcomes. Now it's really time to tell that story. And so you need to start with a clear theme. You really want to lead with the positive. You know, it's tempting to talk about our problem first, but lead with the positive, lead with that, you know, really glowing story of what you've done. Lead with those takeaway points. Provide the sound bites so people can tweet them, they can put them on LinkedIn, whatever it is. Just make them appropriate and appealing for whatever platform you're going to share them on. But again, they're going along with the theme. The supporting details, you know, make sure that they're logical and they're tied to sub-themes. It's really easy to put all these different things in a place that makes the story a little bit harder to read. Just make sure that they're all tied up to that reinforcing theme. And ask yourself questions about how this happened and why these things led to favorable outcomes. You know, let somebody else not that familiar with your story read it before you're ready to share it widely, and find out what questions they have, what things need to be really included in that story. And then sometimes it also helps to draw out the process. You know, put a visual map up of what you did in order to look for gaps and look for things that will really help tell your story. I am a data nerd, and it's really, really, really tempting to share all of our exciting data because it's all so beautiful. But not everyone is motivated by that. And so there's the rule of three. Keep it to 3 key points, 3 key data points that really are going to be the things that people remember. That's going to be what they take away from your story. If you can make it visual, that's even more fabulous. People really remember those visual images better, especially with data. And then what is really powerful to supplement the data are those stories, whether it's a client story or patient story. It really speaks to those motivated by care. And it's really nice to remember that one person in the community that had this positive outcome based on what services you've provided. And then along with that, you know, some of the work that we do, it makes a lot of sense to us because we have been in this realm for a long time. We understand what all the jargon means. But sometimes it's really great to have analogies for these complex concepts or things that don't fit really well within the public realm. Just read Alan Alda's book on If I Understood You, Would I Have This Look on My Face? And it gave a lot of great tools on talking about analogies and making sure that people really understand what you're talking about. We talked about audiences earlier. You know, different stories are going to be very, very different. Some people are going to be more driven by data and the value, especially if you're making that request for funding. Other people are going to be your partners in sharing the story, and so having some more of those touchy-feel elements, such as the patient or client stories, and the visuals are going to be more effective. So just making sure that you're tailoring your story to the audience, and then leaving them with something tangible. You know, whether it be a you know, one-pager, an object that's representative that they can display in their office or their organization to really show what you're trying to accomplish. So we hope that you've gotten some ideas from today's presentation, but more importantly, we want you to share your story. You're doing great work. highlight those different things. So I'm challenging all of you to let us know how we can highlight your work, either on a future webinar that we're going to do or an event that's being held. So email me, post on Simplify, whatever it is, but let us know how you're going to take these concepts and start to use them. Or if you're already doing it, please share. Give us your website, give us your one-pager so we can highlight that. And so our offer to you, since we're making a request, is to review that story, and we can give you tips if you desire. If you think it's great, then fabulous. But if you want tips on how to make it more effective, or you want us to help with the dissemination, let us know. Make the request of us as well. So be sure to post your questions, your thoughts, and other commitments that you're going to make as you're working through those worksheet, and you're saying, you know what, I don't need to do this. I have it already. I'm going to share it with the other C3s. Share that with us as well. Let us know, and I hope you have a wonderful day. Thank you.